There comes a time in everyone's life when they come face to face with mortality. Good morning. My name's Bethany Duffield. I studied history, religion, and sociology in college, and I went on to get my master's in environmental health science in graduate school. I was a Peace Corps volunteer in Uganda first, and then I worked for an NGO as a regional disaster response coordinator for East and Southern Africa. Eventually, though, I became a teacher. So today I'm a teacher here at IST, and I teach science. I became a teacher because I realized the crucial role that education plays in confronting problems and creating solutions. The youth are really important. When I was in graduate school, I discovered the work of Dr. Paul Farmer. He's a renowned physician and medical anthropologist. He did his research in Haiti, and since has impacted access to healthcare for diseases like tuberculosis, HIV and AIDS, and cancer around the world. He famously said, "If access to healthcare is considered a human right, who is considered human enough to have that right?" In his book, Pathologies of Power. My health journey is defined by the fact that in my case, I was considered human enough. Luckily, I'm American. I'm privileged with a job that gives me good health insurance. However, there is profound inequity in healthcare across the world, and this has become even more stark to me following a life-changing event, my recent diagnosis with cancer. So let me tell you a bit of my story. "You don't deserve this." That was my daughter's first big cry last summer after learning that my body's cells were not all being discarded or renewed as they were supposed to be. Her words stuck because they were jarring. Are children really naturally inclined to think that cancer is a punishment for something we do wrong? "Please don't die." That was my son's first big cry, about 2 weeks later. "But I've always told you, everyone eventually dies. Don't worry, the doctors are confident that this can be treated. I'm not going to die anytime soon." Cancer may not be a death sentence anymore for everyone, but it does rearrange everything in your life and change your priorities. After having malaria twice, seeing some horrific crashes on the roads, and enduring a few bad stomach infections in Uganda when I lived there for 8 years, when I came back to East Africa 10 years later, I never imagined that my life or death moment would not be due to some tropical disease or terrible accident. Somewhere in between my March 2023 pap smear at the IST clinic that was negative for abnormal cells and June 2024, a 5.3 by 4.1 centimeter tumor was found or grew on my cervix. This is pretty big. It's almost the same size as my uterus. It had developed its own blood supply, and the cells were reproducing as fast as they could. A PET scan indicated that the cancer cells had spread into my left iliac lymph node as well. I had stage 3 cervical cancer, and it was pretty devastating. After sharing my diagnosis with family and friends, I was unnerved to find stories of at least 10 others from my social media community, spanning several continents, all in their 40s, like me, with their own tale of cancer. 2 have since passed away. In August 2024, The Lancet reported that 17 of 34 cancers had an increasing incidence in younger birth cohorts, including 9 that had previously had declining incidence in older birth cohorts. Basically, the report is saying that there is growing evidence of increased cancer risk in younger generations. The study made headlines around the world. We are all currently at higher risk of developing cancer than our parents were, and we don't know why. In this environment, I hope that my story can raise awareness and cause everyone to pause and think critically about what it means if we say we believe in a human right to access adequate health care. Cancer is different from other diseases. It's not an infectious disease, but it often does start with a foreign entity invading, a pathogen, pollution, microplastics, UV rays. Your body will fight to get rid of it, but if it can't fully, then you could have a cancerous response. Sometimes genes have a significant role to play in the process, but once you have it, the only way to fight it is to let your doctors fight you. They give you toxic things to destroy your cells, all of them, especially the fast-growing ones. And the side effects of this therapy would eventually kill you. But if you let it go, then the cancer, or you, will kill you. And so it is a dance with mortality, to find out how far you can hurt yourself before succumbing to yourself. It's hard to get your head around, and it's often hard to accept such harsh treatment. On August 6, 2024, I had my first day of treatment. I got chemotherapy, external beam radiation, and immunotherapy all on the same day. By the middle of September, I finished 5 weekly doses of cisplatin, a chemotherapy drug that I found out has platinum as its main ingredient. In my environmental systems and societies class that I teach, I would tell students that this is considered heavy metal poisoning. But I guess it poisons the cancer cells the fastest, given they are invasive and replicating as fast as they can. But no wonder it makes you nauseous 24 hours a day. I finished 25 doses of external beam radiation, which affected my bowels so much I couldn't stay hydrated in the last couple of weeks, and I couldn't fill my bladder enough to protect it from the radiation. My skin, where the radiation entered my body, turned dark brown and eventually peeled away. But the tumor shrunk by about 1/3 in size and retreated from my vaginal wall as a result. My radiation oncologist said, "It looks like it's dying." But then my mother said, "But it's not dead yet." So I finished 5 doses also of higher dose internal radiation in a 3-day hospital stay. I went under general anesthesia for about 6 hours to place an applicator that would deliver radiation directly to the tumor. I woke up with this contraption half inside of me and half outside of me and stuck in place with stitches. Then I could not move much for about 54 hours. I did eventually start counting them. I didn't think it would be so hard, but the last 24 hours, there was excruciating pain in my lower back. When the last dose of radiation was complete, and they took out the applicator without anesthesia, it was like giving birth all over again. I got back to my room, now able to curl up into a ball, and I vomited. I felt assaulted. I felt unhuman. And I'm sure that so many others have had these feelings before in a hospital, and I was never aware of the trauma a place of healing could impose. It was my first real hospital stay. But that radiation is a tool that gets the job done to kill the cancer for cervical cancer. The chemo just helps it do it better. Breast cancer is different. Then the chemo does the job. On being discharged from the hospital, the radiation, though, will have affected my bone density and has caused me now to be menopausal. My ovaries don't work anymore. On being discharged, I was briefed on the possibility that my vaginal wall would heal in a closed position and forever cause me pain. But so just all that to say that the sequelae of cancer treatment is very real, and they have their own armada of diagnosis and treatment that go with them. So any health system that wants to treat cancer well also has to be able to treat all of those things. But also, it is quite amazing technology and very innovative. Today, 6 months later, I can gratefully say that I am in remission. I was in the United States during the March break for a PET scan, and it showed no evidence of cancer cells in my body. Remarkable, innovative technology. We went to the beach to celebrate. Immunotherapy is there as well, and that would have played a role, but its biggest role now is to keep the cancer from coming back. I've been prescribed to get a dose of Keytruda every 6 weeks for 2 years. I'm not going to return to the United States every 6 weeks, so I went on a mission to find it here in Africa. Turns out I couldn't find out if anyone had ever used it in Tanzania. When I asked at Aga Khan, they said no. It's not a new drug, but it's being used more and more because they're figuring out how effective it can be for some cancers. Keytruda is a biological agent that blocks the PD-1 receptor on my T cells, the programmed death receptor. This would normally latch on to a PD-L1 ligand on the cancer cells. So they found out that my cancer cells have this ligand, and so this drug would work for me. So basically, it helps my immune system identify the cancer as an invader, and it will attack them and do the job instead of all the toxic things. It's pretty amazing. If you look it up, you will find people talking about Keytruda as a wonder drug for cancer, if you can access it. You also see people trying to access it. So I did find that I probably could have arranged for Aga Khan Hospital here in Dar es Salaam to access the drug from the Netherlands, but I would have to supply a guarantee of payment well in advance and figure out all the logistics. That's because it cost $15,000 per dose. So in Joburg, I found it was available for $10,000 per dose. They've used the drug regularly there. They know how to handle and mix it and how to deal with the side effects. So I've chosen to go to South Africa to get those treatments. Every time I get a dose of Keytruda in the United States, it is in the ballpark of $30,000 per dose. Double and triple what it is here. If I got all my prescribed doses there, the bill would be over $500,000 just for that part of my care. Imagine if you needed it in the United States and you did not have health insurance, or your insurance decided that you didn't need what the doctors told you you did need. When I think of the total cost of my care to date, it makes my jaw drop. It brings me shame. I cannot fathom that my life would be worth so much money that I probably will never make or save in my lifetime. Throughout my treatment, I've been reminded of how lucky I am. I was able to start my treatment in the United States only 5 weeks after the biopsy results came in, and that's partly thanks to my late father, Dr. Sam Zylstra, because he worked in the Central Massachusetts OBGYN community for so long. They were extra kind to me, and they pushed me through the system. To have a job where staff are valued and healthcare coverage is a priority is again something that gives me goosebumps in light of all the care I have needed in the last 6 months and will need for the next 2 to 5 years. I'm lucky for so much more as well. Having a community of people in both Tanzania and the United States who've helped keep my family loved and cared for during our separation was and is a lifeline. Thank you. And so now I come to the not so nice part to think about. What about all of the people in the world who are not so lucky, who are not considered human enough to merit good health care? I spent a lot of time in the infusion room reading. I found out that cervical cancer is a poverty-related cancer, or it's associated with lack of access to diagnosis and care. In Tanzania, it is the most frequently diagnosed cancer and the leading cause of cancer-related deaths among women. Worldwide, it is ranked 4th in both incidence and mortality. You even see the difference when thinking about poverty-related cancers in the United States. Women of color in the United States are more likely to die of cervical cancer than white women because of lack of access to primary care, late diagnosis, and lack of healthcare insurance. Why is this maddening? Because cervical cancer is considered by public health professionals to be nearly completely preventable. That's because of the HPV vaccine and the development of adequate screening measures. In sub-Saharan Africa, on average, only 17% of women aged 25 to 65 have ever had a pap smear. In high-income countries, the figure is around 60%, but that still seems pretty low. The World Health Organization does have a plan to improve these figures, but they reckon it'll take until the end of this century to get there in Africa. I've had a huge team of medical specialists in the United States taking care of me. I have had 2 oncologists, 2 radiation oncologists, physician's assistants, nurses, radiology techs, a social worker, a nutritionist, a massage therapist. The system there moves like clockwork once you get in it, and the support and care is phenomenal. I honestly can't imagine the same treatment being available in Tanzania yet. The human capacity to learn everything that's needed to create and carry out the care is abundant here, but we still need education and technological tools to deliver the care. The USA system is great in many respects, but it still has something to learn in order to make care more accessible, because it's still not accessible to everyone there. Elizabeth Nyamayaro is a Zimbabwean writer. I was reading her book in the infusion room too. She rose from poverty to become a senior advisor at the United Nations, and she is responsible for the He for She movement, which maybe many of you have heard of. It was a successful campaign for gender equality and women's health. She wrote, "Our potential should not be limited by where we are born, nor our dreams diminished by our current circumstances." And she champions the idea of Ubuntu and insists that to solve the healthcare, education, and issues of Africa today, this has to be the core of our solution, that the community takes care of each other no matter what. I am because we are, and because we are, you are. This is a very important idea. The current situation in USA as AID is a case in point of how not working together can jeopardize millions of lives, not just through the cessation of access to drugs and care, but because of the interconnectivity of our world today. If we control a disease in one continent, we should be able to control it in another continent and share in the benefits of a better quality of life. So as I wrap up, I want to ask you, what part might you play one day in the health care system of your own country? You will all likely be patients one day for some kind of reason. So will you be a patient that can only seek emergency care when you need it most, or will you be a patient that gets regular checkups? It should not cost millions of dollars to care for one person. It needs a level playing field. It needs Ubuntu. You should be able to dance with death and still emerge with life. Thank you.